Hey guys, welcome back to our mini-series on Mali. My name's Deanna and I'll be focusing on the impact of political unrest on the healthcare in Mali.
And I'm Lydia, and I'll be focusing on women's healthcare in Mali.
We'll first start the segment off by discussing the political unrest in Mali and its influence on the health sector. Mali is heavily dependent on official development assistance. Official development assistance refers to government aid that helps promote economic development as well as welfare within developing and underdeveloped countries. As of 2010, official development assistance made up 10% of gross domestic product in Mali, and it also made up 30% of the public expenditure. This was inclusive of healthcare. So, for example, the National Health Program in Mali, known as the Ministry of Health, is supported by at least 50 donors. Due to Mali's ability to maintain a good relationship with donors, they were always one of the leading French-speaking countries in Africa when it came to improving their health system and their health outcomes. Despite their good relations with the donor community, the political troubles of 2012 resulted in suspension of aid by many donors. As Hannah discussed in the introduction video, in March of 2012, Mali was invaded by terrorists and their government was overthrown. As a result, numerous donors suspended their funding, which disrupted the functioning of their public health sector and resulted in a collapse of public services, including healthcare. The failure to manage crisis in 2012 was a major setback for improving health services in Mali. Mali is now being bypassed by other countries in aspects such as healthcare strengthening and implementation of interventions. This military coup occurred in northern Mali and as a result impacted the health facilities within that area more than it did in other areas of Mali. The military coup involved armed conflict which resulted in the displacement of individuals, especially women and children, into insecure and unsafe living conditions. This made health outcomes worse and it also increased the number of wounded individuals, but along with the negative effect that it had on healthcare infrastructure, made it difficult to treat individuals during this time of political unrest. Following the military coup in March, in July of that year, Mali was able to overcome a cholera outbreak in Gao. This success in overcoming this cholera outbreak was largely due to a donor, the International Committee of the Red Cross, an independent organization/humanitarian organization. They helped maintain health facilities within Gao and other cities within northern Mali. This is a good example of the important role donors play in the maintenance of public services and public health in Mali. The suspension of donor funding during the 2012 crisis also showed you how reliant Mali is on donors. Once the donors suspended their funding, the health sector within the country came crashing down. This lastly highlights the effect political unrest in the economy has on healthcare and in their interactions with the donor community.
Thank you, Dana. To focus more on women's healthcare in Mali, their healthcare is negatively impacted by many factors, most of them tying into their marriages and experience with giving birth. During pregnancy, both urban and rural Malian women are expected to continue with their normal workload, which is heavy labor that consists of hauling water and chopping firewood. They are rarely excused from their work due to any sickness or tiredness, and they usually continue to work until they're in labor. In urban Mali, despite the lack of physicians, most women seek medical treatment when giving birth. And their social status or their social power they bear over other members in the community, and her connections with different regions and people also define her health status. With the contraceptive use in Mali, a significant amount of women are reluctant to use contraceptives due to their husband's lack of approval, and they're also reluctant to use these due to a lack of knowledge around them, being that they're unaware of the side effects of using contraceptives in the first place. However, most women in Mali will use contraceptives in order to follow with cultural norms of resting with age and focusing more on their grandchildren rather than having children of their own. Status, as I said previously, has a big part in the healthcare of the urban Malian women, as women with a higher social status are more inclined to seek out more medical treatment than those of a lesser status, than those who are more inclined to fight and treat their illnesses themselves. However, in rural Mali, the lack of healthcare is more severe due to women in those areas being unable to either afford healthcare due to it costing more than it does in Western countries, and being unable to get medical treatment in the first place. Those who are licensed in these medical fields usually work lesser hours and usually turn down clients. So the women in these rural parts of Mali are forced to go to more traditional medicines.